Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association with Chief Operating Officer Kyle Longton. Be sure to subscribe to us on your favorite podcast channel. Enjoy the episode.
Hi, and welcome to another episode of AFSPA Talks. This is Kyle Longton, and I'm here once again solo because I'm going to do just a brief intro because we've got an information-packed episode. Today, AFSPA talks Medicare Advantage, and this will conclude our mini-series on Medicare. I encourage you to go back and listen to the last two episodes in the feed, Medicare and the FEHB, which was a discussion led by our CEO, Paula Jacob, and there's a great video on YouTube that includes the slides from that. And then also last week, we had Medicare, TRICARE, and the FEHB. So go back and take a look at that, particularly if you're someone who may be eligible for TRICARE for life. Understand how those three programs work together. But our discussion today really does assume that you listened to that earlier episode about Medicare and the FEHB. And in that episode, Paula talked briefly about Medicare Advantage Plans because we're starting to see more and more of those coming into the federal space. And I wanted to learn more about it, and I wanted to make sure that you all were well informed because there are more options coming out. And I got a lot of calls this last open season from longtime members saying, hey, I'm getting advertisements. I'm seeing it on TV. It's in my mailbox. Should I be looking at this? And it's a great question. So I wanted us all to learn a little bit more about it. And I will say that I personally last year helped my mom navigate the Medicare process for the first time enrolling in it, and then also looking at a Medicare Advantage plan offered by her former employer. Now, she was lucky. She had one choice. That is not the case, of course, for federal employees. You've got a huge array of choices, and we're going to give you at least a starting place today to think about the Medicare Advantage choices there. I wish I'd known some of the things that I learned in preparing for this podcast as I was helping my mom, but we're all going to be better prepared after this. I'll be prepared to answer questions that come up throughout the year. You'll be prepared to make an informed decision. So without any further ado, I want to introduce our guest. Today we have with us John Ficaro, who is the Vice President for Group Retiree and Derisking Solutions at Aetna. John is a sales professional that is focused on developing sustainable long-term financial solutions that enhance the health, happiness, and peace of mind for the retiree population of Aetna's corporate and public sector employees. His approach is consultative to listen and understand an employer's concerns and needs for their retiree population and develop solutions that work. John's Medicare expertise is across Medicare Advantage, Medicare Supplement, and Medicare Part D plans, and we'll hear a lot of that throughout the episode. He does have over 20 years in the healthcare space, having experience across a diverse spectrum of business functions, including sales, project management, service operations, corporate strategy, budget and finance, and sales effectiveness. Before joining Aetna in 2018 as a sales VP, John worked 17 years at Cigna, having been recruited into Cigna's healthcare leadership program and serving in multiple strategic positions across the company. These positions included leading sales distribution strategy, service operations strategy, sales planning, and expense budgeting for national accounts and VP Medicare sales. This is interesting because prior to Cigna, John worked in several mechanical engineering roles, which included design, applications, and sales. And John has been part owner of a successful restaurant in Windsor, Connecticut, since its inception in 2006. John received his MBA from the University of Connecticut, majoring in finance and marketing, and he received a Bachelor of Science degree in mechanical engineering from the University of Rhode Island. Outside of work, John is an avid sailor and golfer and resides with his family in Williamsburg, Virginia. John, welcome to AFSPA Talks.
Thank you, Kyle.
So, John, I want to start off with just a little bit about what you do. And you work in the group retiree and derisking solutions area. That's a lot of words there, and I think there's probably a lot that goes into that. So can you give our listeners a brief overview of what that means and sort of what the day-to-day looks like for you and your team?
Sure. I'll give you a little bit of a background too as well. Currently I'm a VP of Group Retiree and Derisking Solutions, as you alluded to, and I work at Aetna Healthcare. I've been in the healthcare industry for over 20 years now in various roles throughout my career. But of those 20 or so years, about 12 have been in the retiree space. And So what I do, my daily job, I basically consult with plan sponsors, which are, I call them plan sponsors, not companies or clients typically, because they're all in one the same for the most part, but they're entities that basically sponsor retiree plans for their retirees. So what I do is I provide details and information, and I help them navigate the field of what's available in the marketplace with retirees, what benefits and choices are available, and then also what is affordable, because it's great to be able to provide all sorts of benefits, but there's always that scale that we have to employ here as far as what's that benefit to cost analysis to make sure that we're getting the plan sponsor and the retirees exactly what they need, but at an affordable cost. The de-risking solutions basically is a way that we've developed with our partner, Prudential Financial, that allow plan sponsors, it's more of a financial vehicle to basically help plan sponsors keep the promise to their retirees and their employees in the future, balance out that balance sheet to be able to look down the road and be able to continue to pay for and contribute to retiree healthcare.
And I appreciate all of that, because we looked at this internally for AFSPA as an employer, trying to figure out what we can do for our retirees as a much smaller group as compared to our membership. So there are a lot of options out there, and I appreciate also the plan sponsor language. We didn't get too far into an ERISA primer, but I appreciate keeping the language straight. Yeah. We're going to focus today on one of the solutions that I think a lot of groups are selecting for their retiree population, a lot of those plan sponsors, and that's Medicare Advantage plans. Right. We met for the first time last year, and you shared with me at that time that sort of the trajectory at that point is for around half of all Medicare enrollees to select a Medicare Advantage plan by 2030. Is that still the case? Are we still on track for that, or has it sped up or slowed down at all?
So actually, we're expecting to see Medicare Advantage enrollees hit the 50% mark or more in several years, and that's all taking in total. So that's across both employer-sponsored plans as well as individual. So the entire population of Medicare eligible retirees, we expect to hit the 50% or 51% mark probably in several years. We've seen that amount grow significantly over the years because Medicare Advantage just provides a very affordable plan, but includes other things and features that retirees are looking for. So it puts together a Part D prescription plan, let's say, and gives that coverage to a retiree. So it's all in one. Plus, it also provides additional benefits that maybe your traditional plan or a med sup, like a plan A or F or N, that maybe retirees would recognize, gives those additional benefits that those plans don't provide. And I think we'll probably touch upon this later, but some of those benefits are like fitness benefits, Part B premium reimbursement, and transportation, non-urgent transportation to your doctor's offices, meals after an inpatient stay, let's say. So they've been very attractive to retirees, and I think not only attractive in the benefits, but also attractive in the premiums. And I think that's been those two big things have driven the trajectory of enrollees much faster than that 2030 date.
And I think probably some of the folks who might be listening, that's enough for them, and they're going to go sign up for an Advantage plan right now. But I think these plans are very well advertised, particularly in sort of November and December of every year, right, on radio, TV, direct mail, and so forth. But they're maybe not as well understood. You mentioned some of the very appealing features, and they're starting to show up. These Medicare Advantage plans are starting to show up more and more in the federal employee and retiree space. So I wonder if we can take it sort of a little bit piece by piece, and you can at least start with walking us through how Medicare Advantage differs from original Medicare that right, people may be most familiar with and certainly yep, familiar with pairing with their federal plan.
Yeah. So, we call this like the A, B, C, and Ds of Medicare. There's there's Part A, which covers hospitalization bills and things like that. Part B, which covers physician services. I'm going to skip to Part D, this is the dog, that provides prescription coverage. And then I'll go back to Part C, which is Medicare Advantage. So Medicare Advantage basically takes A and B and puts them together in one package. Med sup plans do similar as well. They kind of bucket both A and B expenses together so that you have one plan for all your medical. And then, of course, there's the Part D, which has a prescription drug coverage. Medicare Advantage with Part D prescription coverage puts all of that into one plan. You're not having separate plans. If a member chooses not to go into a Medicare supplement plan or a Medicare Advantage plan, and they just choose to use their red, white, and blue card, so that's fine. They will, typically have Part A coverage because they've worked a certain amount of time during their career and they've been eligible for Part A. Part B, however, you have to enroll in when you are eligible. And that premium gets either you either have to pay that on a monthly basis to Social Security, or you get that deducted from your Social Security check. Typically, some employers may have different mechanisms, but for the most part, you will always be paying for Part B in various shapes or forms. And then, so then that member who chooses to just have it separately would go to the doctor's office. They might have a very high deductible if they go to a hospital. So there's always some need, I think, for many retirees to look at having that additional coverage that provides, payments for those gaps. And that's what Medicare supplement plan would be, kind of gap coverage. But what Medicare Advantage does, and I think this is the, obviously being seen from many federal employees and federal plan sponsors, is the advantages of a Medicare Advantage plan to provide additional benefits and I think in many ways care management programs that a med sub plan or a traditional plan don't have. So there's many aspects of that that's very attractive, and that care management helps to drive costs down because you have a healthier retiree. And then also from a packaging perspective, because it packages everything together in a nice plan. That's not, I got to use my Medicare, my original Medicare card, and then I got to use my MedSup card, and then I have a prescription card. It's just all in one.
Excellent. And I think Medicare supplement plans are also advertised out there, and a lot of our listeners may not have delved into them as much because oftentimes their federal plan has stood in place of that supplemental plan. It's paying the deductible, any outstanding co-insurance and so forth. So and the same with Part D, that most of the time, very, very few of our listeners will have taken a Part D plan because the FEHB plans offer comparable coverage for prescriptions. So right. Is there anything just at this point that you would want to add about the Part D coverage and particularly how it works with Medicare Advantage plans when you've got a Medicare Advantage plus Part D?
Yeah. So in that case, if a retiree already has prescription coverage through their commercial plan, let's say their active plan, then there's no need for them to obviously choose a Part D plan separately. But when it comes to a Medicare Advantage plan, you would want a Part D plan because what it does is it integrates very nicely with the care management aspect of the entire plan. So in other words, we're able to understand requirements, needs that a retiree may have based on their utilization of their pharmacy benefits. And what that does is it channels it back through the medical plan to understand maybe they need some outreach by a nurse. Maybe they need some additional coverage. Maybe we should provide some additional information to the member so that they can improve their health. So there's that integration with the medical that I think is a very attractive feature of a Medicare Advantage plan. Now, a member may not understand that until they're into that type of a plan. But from that perspective, it makes it a very attractive way of helping a retiree improve their health because it facilitates a better care management model for that case. And also, I think from the perspective of Medicare has been very good with us in the sense, and good with us carriers that provide those benefits, because we have the flexibility to offer multiple types of formularies and options and things like that to basically, improve or reduce any disruption that they would see currently.
Excellent. And we've talked about premiums. Typically for most people, Part A is premium free because they paid into the program while working. Part B is something that they're going to have to pay for. Is that true with Medicare Advantage? Will people still need to pay for Part B? And is there, in the commercial space, we'll come back to the federal space, but in the commercial space, I think you mentioned there's usually an additional premium for the Medicare Advantage plan and even for Part D. Is that right?
So correct. So in the commercial space, it depends on, who is paying the premium, or, there's always typically an employer contribution. So the employer would pay a certain amount based on the amount of retirees' years towards their premium. Sometimes it's 100%, maybe 75 or 50% of the premium. So depending upon who's paying for that, that just like a commercial plan would be, there would be some either premium sharing for the medical and the prescription plan, depending upon how the employer structure is for contributing to that. For Part B, as in boy, the retiree would continue to pay for their Part B expenses. But the beauty of Medicare Advantage is that some plans, and what we've been seeing and doing some of the federal plans, is to be able to provide a premium reimbursement for Part B, not for the entire amount, but for some, let's say. So that's, and Medicare actually allows us to do that, which is a very attractive feature, because you're always going to be paying for Part B, let's say, for the most part, whatever plan that you choose. Right. And also, one more thing about the premium, if for a Medicare Advantage plan with Part D, that rate is all in one. So the premium that maybe somebody is paying for a med sub plan, and they might have, a separate Part D plan or a commercial plan, they might be paying separate premiums. For Medicare Advantage and Part D plan, it'll all be into one premium.
Yep. I have a friend who carries 3 different cards. They've got their original Medicare card, right, their supplemental card, their Part D card, and it's which one does what when they get to the doctor's office. So there's some advantages there in sort of consolidating things. So to talk general and about the commercial space, and I want to move to a more targeted discussion of the federal space, because that's obviously where we've worked together and where our members are interested. And there's been some Medicare Advantage options in the FEHB program for at least a decade, with Kaiser Permanente originally, and then later Aetna offered something called Aetna Direct, and more recently a true Medicare Advantage plus Part D option with Aetna Advantage. United Healthcare has been in the space. And then in the last 2 years, actually starting in 2021, we saw our friends at the American Postal Workers Union Health Plan, or APWU, offer the first option, if you will, for a Medicare Advantage plan within a fee-for-service or the experience-rated plan, depending on how our listeners are familiar with that language. And we've seen others. So within the Aetna administered plans, rural carriers benefit plan, mail handlers offered something starting in 2022. Many of our listeners are familiar with Compass Rose, which is working with United to offer something this year. I will say FSBP did hold off. We've been in discussions about this. We decided not to jump in 2022. I have official clearance from my boss that I can say we are absolutely considering a Medicare Advantage plan for 2023. And so we won't discuss exactly what that will look like or the specifics, but I'm hoping, John, you can walk us through what these plans look like in the federal space, and maybe some specifics about how they differ from commercial. And so let's start there. How do the Medicare Advantage plans in the federal space differ at all, if they do, from those commercial plans that we've been discussing?
So, my job when I'm working with a client, plan sponsor, is to minimize what would be perceived disruption. So, many retirees have fear of change. I don't want to change from what I've had for so many years and things like that. And they want the information presented to them in such a way that presents what they have today. There's going to be much more benefit to the plan they're going to tomorrow. And what I always like to do is to make sure that they provide us their current plans. The federal folks, let's say, these are what our retirees have today. And what we'll do is we take those plans, we take the formulary, we take utilization information as far as what the retirees are using for drugs, let's say, if we're looking at the prescription. And we try to duplicate as close as possible. We actually are equal to or better than in many, many cases, depending upon what the plan sponsor and the client wants us to look at. But for the most part, we minimize that disruption to either be tiny or zero with the additional benefits that are provided. Because now we are the facilitator of the plan, meaning that we take on that particular risk of paying for the claims, we're able to do and employ a lot of different things that are maybe different from the commercial plans per se. Mostly I see commercial plans, the active plans when you become a retiree are utilization management type plans. It's claim payment type of a plan. When you go to a Medicare Advantage plan, it becomes more, there are two different things. One, it becomes more of a care management program because we want to improve your health and provide you the tools. We can't force you, but we want to provide the tools and information that's available to help the retiree to make good choices because they want to be healthy. And so why not provide those types of programs that we can help employ that better health trajectory for them. The second big thing that's different from a commercial plan is that we're rated by CMS, by the Centers for Medicaid and Medicare Services. So Medicaid, so basically Medicare, they look at us carriers that provide Medicare Advantage plans, and they rate us on a 5-star scale. We're at a 4.5 star scale right now. So we've been above 4 stars for the past 9 years, actually. So we're a very, very high quality plan. And we make sure that quality rating is very high, and it takes into account all the different features and items that Medicare uses to evaluate us. And it basically, many of those items are geared towards what we're doing with the retirees that we have on our plans. Are we answering their questions appropriately? Are we employing the best kind of care services for them? Are we handling any complaints they may have appropriately and fast? So it's really this oversight that commercial plans don't have, that we have to have, the ability to be able to, service the retiree as best as we can. And those two things are the biggest differences between the commercial plans and the Medicare Advantage plans.
I think that's what's so appealing to us. We have those same through our accreditation process with in AFSPA's case, AAA-HC. We have and with OPM we have those same requirements for responding to any kind of complaint or issue that comes along to managing care and utilization and having programs in place. And I really appreciate that. About the Medicare Advantage plans, as I've been learning more about them, the care support in particular is something that we pride ourselves on for our FSBP population. It just doesn't exist for people who have original Medicare primary. They right. Go into the hospital, they get discharged, and then a claim comes through, and we find out about it after Medicare's already processed it. So we don't have the opportunity to intervene. What I'm hearing you say is with and I say intervene to help, to provide additional resources and support. I'm hearing that is absolutely, it's a key component of Medicare Advantage plans.
That's right, exactly.
So let's talk about some of those other special features. So John, I think we talked about this before, but I can't tell you the number of times I get requests from members about silver sneakers and why we can't include it. And then I have to quote IRS code and consult our attorney and everything else. So for my peace of mind and literally dozens of members out there every year, first of all, does the Medicare Advantage plan provide coverage, at least the ones you've worked at? Does it provide access to silver sneakers or at least a similar program?
Yes, it does.
Okay.
It's actually one of the most utilized additional benefits that are provided in a Medicare Advantage plan. And what Silver Sneakers does is provides free gym memberships across about 17,000 participating fitness centers throughout the United States. So it's a very, very good extra benefit that I think is heavily utilized and employed by many retirees. And you want them to work out. I work out, most days of the week, and I would consider myself doing that into my retirement age too. I think a lot of retirees want the same type of a feature. So that's one special feature I'd say that is utilized in the Medicare Advantage plan.
And what in particular I will appreciate it if we're able to move forward. But let me ask about the network. So my conception before we've started talking was as of Medicare Advantage as sort of being limited in the network. It's just in maybe my state or my metropolitan area or region or something like that. And if I go outside of that, I don't really have the same level of coverage. Is that the case with all Medicare Advantage plans? How is that working for these options offered within the federal plans that are offer national coverage?
So there are two differences between an individual market. If you went to and bought an individual market plan that's not affiliated with their employer, let's say, they could have, most of them would be maybe an HMO, or some of them are PPO.
Mm-hmm.
HMOs would obviously limit your ability to go to different providers. You'd have to stick with the network, or you would be paying out of pocket. What we offer for many of our commercial, clients that we service on the group space, group employer space, are PPO and extended service area plans, which means that a member retiree can go to any in-network doctor or any out-of-network doctor that accepts Medicare. So typically, that's about 94%. I think the number was not that long ago of either the doctors or facilities in the United States. So if you live in New England, let's say, and for the winter you might want to go down to Florida if you have a house down there, let's say, and you want to see doctors, there's no restriction on that. And they also provide where you don't have to get referrals. You can go to a specialist. There are some requirements for some conditions and benefits that might require a prior auth, but for the most part, it's referral free. So it gives you the flexibility, just like if you were in a med sub plan or a traditional plan where you just go in to see a Medicare doctor.
That sounds great. And particularly sort of having that flexibility, and also you've got the support there. So if a referral is needed, you've got a plan there to walk through that process, or prior auth, I should say. Let's talk a little bit about prescription benefits. I appreciated a lot what you said earlier about looking at the existing plan, looking at the benefits, and also looking at the formularies, because I think that's going to be a question that people have, or something that they take a close look at. How does that work? Can you talk about the process again, but also is there an exception if it's a different formulary from the regular plan?
Yeah, so just like what I was referring to before, when we try to evaluate a current plan and formulary that members are using on their current plan, and we're looking at how we duplicate that for a Medicare Advantage and Part D plan, we look very heavily at the formulary. So we want to make sure that the members, the retirees, are not going to see a lot of disruption. So we have the flexibility of offering different formularies. Either they're closed, let's say, if you want to narrow it down and provide cost savings that way, or open formulary, which is many times what we use for depending upon the client's needs and retirees' needs, so that they can basically still utilize the same drugs that they're using today, and use them tomorrow if they're in a Part D plan. There is an exception process. So let's say, and the way we try to design some of these, and I've seen, I review these disruption analysis reports, and we look at anything that may fall out. And typically we see a lot of those types of drugs as, they were taken off the market. They may have been used in the past, but now they're not. So, we want to make sure that there's formularies that are providing those safe drugs that are approved, and, any ones that have been taken off the market are removed, of course. But let's say there is a drug that somebody's taken and, it's not covered on our formulary. Well, there is a process that they could get an exception through their doctor. And the doctor knows how to proceed with the process with us to have that done. Very rarely is that needed, but if necessary, there's a process for that too. We don't want to have a retiree without having the right drugs that they need.
Makes a lot of sense. And I want to go back to a question I probably should have asked before when we were talking about some special features. Sometimes we see the Medicare Advantage plans having vision and dental benefits that maybe aren't included in the other plans, traditional health plans. Is that the case with some of the plans being offered in the federal space?
Yes. So let's clarify the two different things between hearing and vision exams, and then also vision hardware and hearing aids. So in every Medicare Advantage plan, vision and hearing exams, your yearly checkup, those are covered. There are the additional benefits that we do offer, and we do this many times, and we have that ability, and we see this a lot in the federal plans, where there's a need for hearing aid coverage, a certain amount of dollars per a certain amount of time. Let's say you've got 3 years to use up a certain amount of money, let's say for hearing aids. And then for vision hardware, that's usually a 1 or 2 year type of benefit, where every year or every 2 years, you have a certain amount of dollars associated with getting hardware. So either contacts or glasses. So those are very good benefits. There's some other ones too I can speak of that we see a lot of. Non-emergency transportation. So, obviously there's always emergency transportation with an ambulance, but let's say you need a ride to go see your doctor. So we provide those types of services. Lifestyle coaching is another benefit that's very, very good benefit. So let's say you want to quit smoking, and we have that smoking cessation program through lifestyle coaching. You want to, you have diabetes and you want to have some information and support. We provide those, we provide that support through our nurses and doctors. Meals after an inpatient stay. Some retirees may not have the family or friend support necessary. Let's say if they get home from after being in the hospital, and they would find it hard to cook. So we have a program for that, where we can provide those meals to the retiree at their home. So it's more than just like a claims payment model that I think the current plans, traditional plans, med sup plans are. We really do want to improve the health of the retiree, and that's why these additional benefits are provided in these plans.
I think that's great, and longtime listeners of this podcast will know that I am passionate about hearing aids and hearing aid benefits, having worn mine for 8 years, and I'll refer folks back to our second episode ever if you want to learn more about hearing aids, and also go back to our last episode of 2021 to learn about lifestyle and condition coaching with Dr. Jonathan Rubens. Did a great podcast on that, particularly around the holidays, but it's applicable anytime. And whether you're a Medicare age or younger, take a look, because there's some good information in there, and will really show the value of having that access to that program, regardless of what plan you have. So John, I really appreciate you mentioning that. Let's talk about cost. So we went over commercial costs before. In the federal program, let's go quickly. People are still paying their Part B, right?
That's correct.
Okay. What about the Part D premium? How is that handled in these federal Medicare Advantage programs?
So the Part D premium is actually within the premium itself of the entire Medicare Advantage and Part D plan.
Okay.
So we call it MAPD. just for short, or MAP, as I think you were referring to. And that Part D premium and the medical premium are all in one.
Okay. And for folks who are enrolling in this through the federal program, they would still be enrolled in their program. The OPM is still going to pay their portion of the premium. The other portion is going to come out of their, in most cases, their monthly annuity. But there's no additional Part C premium. That piece, their normal premium split between OPM and the member takes care of what would normally be the Part C premium. So I got to ask, what's the catch?
It's funny thing is I do get asked that a lot from many clients, as we present them with our proposal, to go into a Medicare Advantage and Part D plan. A lot of times what we've seen over a traditional or Med Sup plan is 30 to 50% less premium than what their current plan. And I get asked that question actually a lot. What's the catch? How can it be that low? Or and the reason is, and I've kind of spoke about those things, but one is the care management aspect of it, because and studies have shown these are out there on the internet from very valid foundations like the Kaiser Foundation and those types of, and some consultant firms have done their studies as well and have shown that Medicare Advantage does truly, cut the cost curve by the fact that members are healthier. So, and that's the goal. That's the goal.
Okay.
That, and also because we're a high star rated plan, because of the way that we can facilitate a Medicare Advantage plan, and we're a very high quality plan, we're actually helping to save money, I guess you can say, from the fact that Medicare, who still reimburses us to pay for some of those expenses because Medicare is still doing their job, but they provide a little bit more of a bonus to high star rated plans. And that money doesn't go in our pocket, by the way. We have to provide those additional bonus payments because we're actually saving money down the long run. And that goes back into either the premiums, by lowering cost, or improving the benefits, or both. So that's why you'll see those maybe Medicare Advantage rates, much less than your current plan because of those features that are inherent in a Medicare Advantage plan.
And we have a similar arrangement for our plan with OPM, that we've got to meet certain standards. We get a certain rating every year, and that affects additional money that comes back that, just like with the Medicare Advantage, we have to put back into the program. So this model hopefully is familiar to the federal enrollees and to our listeners. But if not, just know that that's where any kind of money that's going back into the program, it's helping keep premiums down across the board for everybody. But also any money that comes back is going back into the program to improve it. John, I asked you this question in another conversation. I almost stumped you, so I'm going to ask you again. Is there any reason why you would recommend somebody not consider a Medicare Advantage plan?
I've been doing this for a long time, about 12, 13 years, and I really can't think of a reason why a member would not at least consider looking at a Medicare Advantage plan, just because of the ability, the features, the things that you can gain from a Medicare Advantage plan. If those things that entice you and you're interested in those care management programs and wellness programs and silver sneakers and things like that, if that doesn't do it for you, then you can certainly stay where you are if you're happy, of course. But I think many people see the benefits of these plans, and that's why the enrollment is growing so significantly. Yeah. And I think I didn't mention this, but 42% of all Medicare eligible retirees in the United States are in a Medicare Advantage plan. And like we were talking about before, we see that probably reaching the 50% mark pretty soon. So.
Okay. And I appreciate you said in the United States, because we have some listeners and certainly a good number of members overseas. And I think Medicare Advantage is not different from original Medicare in the fact that there's not comprehensive coverage outside the United States. There may be a travel benefit that would cover folks, but if somebody's living outside the United States, this probably would not be the option for them. Is that fair to say?
That would be a correct statement to say because Medicare. So to be in a Medicare Advantage plan, to be in a Medicare supplement plan, you have to be stateside. You have to have a United States address, because Medicare does not reimburse to non-Medicare doctors. And of course, if you're in Europe, let's say, in France, and you live there, then those are not Medicare doctors. I will say, though, one thing on a Medicare Advantage plan, it does offer emergency care services. So if you're traveling and let's say you break a leg or something like that needs urgent care, that would be reimbursed.
Yeah. So I encourage anybody who may be spending significant time outside the U.S. or certainly living outside the U.S., check the details, or feel free to contact me or some of my colleagues at AFSPA. We'd be happy to walk you through that. And I'll refer you also back 2 episodes in your feed to Medicare and the FEHB to learn a little bit more about the specifics that our CEO, Paula Jacob, covered in that episode. So John, before we wrap up, do you have any closing thoughts to share? Anything that we haven't covered that you think is important for people to understand about Medicare Advantage plans?
Yeah, I think we've covered a fair amount of things. Again, I try to always keep it simple, and looking at a Medicare Advantage plan and considering it, look at its features, look at its benefits. I think many of them are attractive to many retirees.
Yeah.
So if it does interest you, if you're seeking that better care management model and those additional benefits, and at this basically with no additional disruption or differences from your current plan, then I would say consider looking at least into it, or be interested in joining one. Excellent.
Well, John, thank you very much for your time today. I helped family members navigate enrollment in Medicare Advantage last year, and I've learned quite a bit just from our brief time together today and previous conversations. So I'm sure our listeners have as well. And I think it's very possible we'll be talking again in the future. But again, thank you for your time and sharing your expertise today.
Thank you, and have a great day.
This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or other products offered by AFSPA, the policy provisions will prevail. Thank you for listening, and be sure to subscribe to AFSPA Talks to catch our next episode. Please rate and review us on your favorite podcast app and share feedback with us on Facebook, Instagram, or LinkedIn.